I'll duck out of the presentation occasionally and see if anyone's put any questions in, or just start speaking if you're happy to do that as well. Okay, so I'm just going to share this now. Okay, so my name is Luise, and I'm a dietitian at Salford Royal Foundation Trust. So the point of today is to try and give you some information about what it's like to be a dietitian and the kinds of things that we do. And I don't know whether anyone's already interested in that kind of role in the future, but it would be great if you have any questions, just to keep them coming through. Don't save them for the end. So a wee bit about me. So my name is Luise. It's an Irish name, so I've put it down. It's just easy to say, but the spelling isn't helpful, so it's Luise. I'm from Belfast originally, and I've been over here in England for many years. I imagine longer than you guys have been alive. And I live in Manchester with my husband, and I have 2 children. One of them has just gone off to university, so he's probably maybe a year or 2 ahead of you in age, perhaps. And then I have another daughter who is kind of coming up through school. And so I've been a dietitian for 8 years. So even though I am obviously not in my 20s, I've been a dietitian for 8 years because I decided to retrain. I used to have a career in the computer sector, but changed my mind. I'll come back to that in a wee bit. So I'm 8 years into this, and I really love food, cooking, eating out, etc. It's not mandatory to be into food as a dietitian, but does help a little bit. So just a little bit more on that. So I did go to university when I was 18 originally and I did a degree in computer science, because at that age, that's what I wanted to do. And I worked in the IT sector for quite a long time. So I was 16 years in that job, or in that role, all that time, advancing through different sectors and stages and promotions, etc. And I was diagnosed with type 1 diabetes when I was in my 30s. And that's kind of what kicked things off for me, thinking about changing my career. And the only thing I really wanted to do was to be a dietitian. And kind of the reason for that really was because I had a dietitian who was really a big part of the care that I received after my diagnosis. And she did a fabulous job. And so that had a really big impact on how I felt. I really liked the role that she, displayed to me. It was an educational type of a role. She calmed me down and gave me lots of, knowledge and guidance over the first couple of years. And it was a life-changing event for me. I also had a brand new baby, so life was, kind of a bit chaotic at the time. And having this knowledge and confidence with managing my diabetes really appealed to me. I loved the fact that there was a real, straightforward health messages there, but also an educational side of things, and that rolled into one role, really kind of sang to me, really. And so I went back to university as a 40-year-old to become a dietitian. So just on that note then, how do you kind of, become a dietitian? Where do you get your education from? Well, I went to Chester University. I live in Manchester, and obviously I was kids and I didn't want to move. So I commuted across to Chester on the days that I was on campus, and it was a bit of a slog, but it was preferable for me. Otherwise, I would have moved there. So I did a Bachelor of Science degree in nutrition and dietetics. However, before I got there, I had to do science A-levels because I didn't have any from my time at school, and the degree that I had from my computer science degree wasn't relevant, didn't have any kind of science elements to it. So I did a 1-year access to science course first of all. So I did that also as a chance to see if I could go back to education, if I could embark upon, you know, a subject that I didn't really like when I was at school and kind of shunned. And so I did a 1-year access to science course, and I really loved it. And it confirmed to me that I felt I could carry on and embark upon the degree. Really enjoyed learning again. It was a different experience as an older, mature student. And I loved all of it, but this particular parts of the modules really sang to me and really appealed to me. So I loved the nutrition side of things, getting into that nitty-gritty of what food contains and the impact it has on health. Physiology and kind of anatomy, that was also really interesting. And there's a behavioural element to the degree as well, because although it's a science degree, you are dealing with the general public, you're dealing with people. And it really helps to be able to think a little bit laterally, a little bit out of the box, to try and explain to a patient why they should embark upon a certain treatment, etc. So, and I've learned a hell of a lot about that ever since, really. It's always a learning journey with things like that. Okay, everyone okay? Just shout out if there's anything that you want to comment on, so I'll carry on for a little bit longer. So a little bit about dietitians. There's an awful lot of myths that, you know, hang around about what we do. We're often kind of seen as the food police. People presume that we're going to comment on what they're eating and maybe comment on their weight and things like that. I find when people introduce me to new people and they tell them I'm a dietitian, they'll immediately kind of say, oh, don't look at my plate, and, you know, oh, I need to lose some weight. And they talk about things like that, which is a very tiny little part of what a dietitian does. And actually for me in the job that I currently do, it's no part of my job. So the definition of what a dietitian does is that we translate the complex science of nutrition into easy to understand advice. So there is a real science element to the degree, and we take a long time to learn the biochemistry of food and the body, how these two things work together. And then that's you can't give those messages to a lay person, to a patient who's got some kind of health condition that needs your advice. You have to translate that and give them practical advice as well. And so that's kind of the definition of what we actually do. But the sectors that we work in are varied, really varied. So not one size fits all. So there's really a lot of choice, and often dietitians who I know who've been in the industry for 20 years have worked their way through several of these sectors to find the one that they settle in or like the most. So we work in the acute setting, that's the hospital environment. That means, you know, poorly people in beds, recovering from, you know, health conditions, surgeries, etc. We also work in the community, so they are dietitians who go out and about. Sometimes they're based at a GP practice or just an office somewhere in the trust geography. They'll go into nursing homes, they'll go into people's homes. They'll deal with outpatient appointments and things like that. So the kind of ultimate difference really between acute and community is that often their patients are reasonably well. They can leave the house and walk into an appointment and have an appointment with the dietitian, and they may see them, you know, many times over the period of a year or more than that. Whereas in the acute setting, the patients are acutely ill. It's here and it's now, and they need our help right now. There's a fair number of dietitians who work in the private sector. So basically they run their own business. They market themselves as a dietitian. They're self-employed, and patients will seek them out and pay for their services. In the private sector, you'll often find they have a specialism. So there'll be a paediatric dietitian or there'll be a gastro dietitian. So they'll have some kind of specialism that people will find them and pay for their services. Sometimes you can do both. I know many dietitians who have 2 days a week where they're a private dietitian and 3 days a week where they work for the NHS. You'll find dietitians in the sports arena, advising teams and athletes on their best diet to get the best performance for themselves. The catering sector, so they're not working within the NHS, but they're working for catering companies, so companies that maybe provide meals and food to prisons or schools or nursing homes, etc. And behind all of those meals that kind of go out almost boxed up, there'll be a dietitian somewhere involved in designing them and defining each of the micronutrients, the calorie content. A bit like the labels you'd see on the back of food, that information has come from probably a dietitian somewhere in the background. And of course, there's research dietitians. A lot of the big food companies will have dietitians, again, working in labs almost, and looking into the latest government guidelines on how to adapt meals. So they've got a new thing that's come out recently is bread is going to contain folic acid. So there'll be some kind of research in the back of that, and dietitians are often involved at that level too. And public health. So public health dietitians are often involved in campaigns to help increase exercise, reduce weight, eat in a different way. That's quite a nice, I did a little bit of that at some point myself. And that's a much more kind of less sciencey approach, but very outward looking and very collaborative. That's quite a nice role to do as well. So some roles can be very sciencey, if that's what appeals to you, and others are a lot more holistic, patient-centered, focused on exactly the person in front of you and what you can do that's best for them. So really, once you're qualified with your dietetic degree and everyone comes out with the same degree, you can then choose which way you navigate yourself. Okay, but what we all have in common, if you've worked in any of those sectors, is that we assess, diagnose and treat dietary and nutritional problems. Or if you are in the research role, then you are trying to achieve government guidelines perhaps that say, we have to have a certain amount of protein or certain vitamins in our diet every day. We have the protected title of dietitian. So because we are NHS trained, that means that we can use the word dietitian as our title. We're not nutritionists. There are some fabulous nutritionists out there, and there are a lot of nutrition degrees you can do at university. But nutritionist isn't a protected title, meaning anybody could choose to be a nutritionist. So like I say, there are some amazing ones, but there are also a lot of them that set themselves up because they have an interest in food, and then they can call themselves nutritionists and pay for their services, but they cannot call themselves dietitians. You've got to go through these specific degrees to get that. And we're regulated by the Health Professional Council. And the reason I mention that is physiotherapists, occupational therapists, doctors, opticians, all of those roles are under the Health Professionals Council. And that means we all adhere to the same code of conduct. So you get a very consistent service wherever you go, because we're running on these well-trodden but well-researched guidelines and rules, etc. If that's the kind of thing that appeals to you, and it does, it keeps us safe and it keeps us practicing safely as well. Okay, so before I just kind of launch into a wee bit more specific things about the job that I do and then dietitians as well, I'll just nip out of sharing for a second. Anyone, any questions? There's nothing in the chat box, so I presume we're good to carry on.
Yeah, there's no questions coming through yet.
Well, no.
So if there are, I'll just jump in with them.
Fine, that's great. Okay, let's share again. Is that okay? Can everyone see that all right? I'm back to where I was.
Yeah, all good.
Well, thank you. So my department then, so I work for the Northern Care Alliance. That's an umbrella over a number of different trusts in this kind in North, in the Manchester, Greater Manchester area. And so I work within Salford Royal Hospital. There are approximately 40 dietitians in the department. We're not all in one big office, we're spread out across the hospital or even outside of the hospital. And there are about 12 different specialties amongst us, because we have a wide variety of patients and services that Salford offers. So we have dietitians who exclusively work with renal patients, or patients who have gastro issues or gastro surgeries. We work with people who have what we call intestinal failure, where that kind of, the route from mouth right through your gut and the processing of food, that doesn't work very well. So they're involved in all of that. We have weight management dietitians who maybe prepare people for those special surgeries for stomach reductions and things like that. We have ICU dietitians, and that's just a few of them. So there's a really good varied set of specialties, and we can move across them if you're in a certain type of a job. If you graduate from university as a dietitian, you'll start as a band 5. That's the entry that you will go in at. And but the majority of dietitians tend to spend a lot of their career as a band 6. So that means they have a specialism. They've decided they're going to, stay within a particular area. And get a deeper and wider knowledge of that. You can become a band 7 dietitian and a band 8, and as you go up that kind of ladder, you become maybe a little bit more managerial, or you become a bit more involved in the services that we provide and projecting them for the future and getting those initiated. That's also a really interesting part of the job too. Okay. So my career I put so far, because I'm planning on carrying on. When I first graduated, so eight years ago approximately, I worked in South Manchester, and I had a community role. So I did that role of moving out to nursing homes, going in to see lovely little old ladies, little old men in their nursing homes, because often they maybe have an issue with eating or losing a bit of weight. And then after about 6 or 7 months there, I moved into Wythenshawe Hospital, and I started working on the wards. And I worked within different specialties, such as the heart and lung patients and gastro, worked with cancer patients. And then the last role I had there before I moved was in paediatrics or children's. That was on the ward, and a lot of outpatient types of appointments as well. Really enjoyed it. It was good fun. Some of the kids were amazing. So, but I really prefer working in an acute setting. So in my mind, I've decided I wouldn't go back to community. That's just my preference. That's how it's evolved for me. And then in June last year, kind of in the middle of COVID, I moved jobs, and that's why I'm now at Salford Royal. And I'm a rotational dietitian. And that means that I spend a year in a specialty. So some of those ones that I mentioned before, like renal and neuro, etc. I've spent almost a year working with elderly patients within the hospital, which was a really interesting area to work in. And then I've moved on now, and I've moved to a different rotation, which I'll tell you about in a second. So the role that I have now, I'm an upper gastrointestinal cancer dietitian. So, or we call it an upper GI dietitian. So that means that the bit of the body that I concentrate on is from the back of the throat, so where your kind of food pipe would start, right down through the stomach, just to where the stomach joins your small bowel. So that bit of your anatomy from kind of back of your throat to the top of your abdomen, if you like, or the bottom of your abdomen is where I concentrate on. So it's if people get cancer there, So I see patients who come into an outpatient clinic, meaning they've had some kind of issue. They've attended their GP perhaps, who's suspected there may be something wrong and they need to have some tests doing. And it's very early stages when they've been diagnosed with a cancer. And often by that time, they're understandably a little bit worried about how things are going to progress for them. And often that affects the way they eat. But also because of what's going on with this part of their anatomy, maybe they are finding it difficult to eat as well. So I'll advise them on ways they can adapt their diet so that they can stay well nourished. And that's really important because they've got a lot of steps of difficult treatment ahead of them. And if you're not well nourished and your weight isn't reasonable and you're not able to put food into your system on a regular basis, it can, you can become malnourished, and that doesn't give you a very good foundation for getting yourself through some difficult treatments and surgeries. So once I've seen them in clinic, they will then come into the hospital and they'll have some surgery, and it's quite a large, there's a number of different operations that we can do, and they will be with us in the hospital for anywhere from maybe a week, which is really good if they can recover quite well, to even a couple of weeks or even longer than that. It just depends on how they recover. And that's when I see them on the wards. I've seen them in the outpatient clinic, and then I'll go onto the ward and I'll see them there. And that's just a really, really interesting part of my job, because every patient is different. Although we do repetitive surgeries, we take away some of their esophagus, we take away their stomach. Everyone's different. Everybody responds differently to treatment. Some people are jumping out of the bed within a couple of days, and others just need a wee bit more time to get strong again. So how they respond to treatment is different, and that's why you end up kind of being involved in the best plan for them. And that's where I work very closely with the doctors who also work in the upper GI service. So these doctors and surgeons who perform these operations, and specialist nurses or the nurses on the ward who are looking after these patients. We all work together very collaboratively to work out the best treatment for the patient. That's known as MDT, so multi-disciplinary teams. We work really well together to make sure that we're putting the best plan in place for the patient. So what's quite nice about that is you travel along that journey with the patient, and then when they do leave hospital, they come back again to the clinic for checkups, and we will spend some more time with them. We often have a telephone relationship with the patients as well, if they want to call us in between appointments because they're a little bit worried about something or they want to adapt their plan. So we'll also have those kind of appointments with them as well. So it's really interesting job. Okay, so why do I like my job? Well, I really like dealing with people, and I think if you've attended any of these other sessions for physiotherapists or other roles like that, I think it's probably coming through loud and clear that you have to like people. Really, you have to like dealing with all different types of people. So that's one of the top best things for me. I like my job because I like that challenge of having poorly people who are unwell, and they're very vulnerable. They're often a little bit frightened, and they need us at this really important time. So, I've learned over the years of being a dietitian that that part of the job is really important, just treating them as a person, looking them in the face and having a nice frank chat with them about the best things for them, and they often really take that on board and run with the plan that we want to put in place for them. So I think it's a pivotal time of their life, and then they need us. And I like working out solutions to that wide variety of scenarios that healthcare always brings up. Sometimes it's practical things, like they don't like a particular flavour of something, or they haven't got a microwave to, heat up their food with. There's all kinds of things that get thrown up. So it's all very, very unique. But one of the favourite aspects of this particular role that I'm in right now is a thing called enteral feeding. I thought I would just bring this into the presentation just to show you that not everything we do is about, a plate of food or a shopping list, etc. So this is a type of feeding where someone is fed through a tube. Now, often the tube is in the nose and it goes down the back of the throat and into the stomach. Or sometimes it's actually there's a tube put through the wall of the stomach directly into it. So enteral feeding is when a patient cannot eat enough to give them all of the calories they need or all of the nutrition really that they need, or they can't eat at all because of their clinical condition. Sometimes after those hefty surgeries that our patients have, they're not able to swallow for a while, or the doctors want to protect their swallow, so they'll put food in through their tummies. And that's a really interesting part of the job, because it's super important to keep nutrition going in every day to allow this patient to recover well. Now, often it's only for a short period of time, so maybe whilst they're in hospital with us, just for a couple of weeks or 10 days, something like that. And it's great to see them get stronger, because this nutrition is going in not through their mouth, but maybe through their tummy or down through their nose. And then once they recover and get strong and they're starting to eat again, we can take the tube out and they don't need it anymore. We do sometimes send patients home with these tubes in, and that's when our community colleagues will take over and they'll carry on the care from their community point of view and visit them at home and things like that. So it's a really important aspect of being a dietitian, trying to find ways to keep the patient nourished. And we often have, conversations with the doctors where we might say, I think we should put a tube in them now. Actually, they're not really recovering as quickly as we hoped. And the doctors often say, well, if you think we should, then we should. So we have those kind of conversations as well, which is the MDT thing happening again. Okay. So that's kind of like a potted update on what I do and in my job currently. But if you're thinking about dietetics and how it evolves over the period of your career, as with all NHS professionals, dietitians, we have to continually update our skills, and it's the same with any job you have in life. You never stop learning. But with the NHS, we have journeys that we go on to make sure that we are keeping ourselves up to date. So it's not really just learning more and more things, but evidence is changing all the time. We have to make sure we stay abreast of all those new reports and research that is coming out. So staying up to date with all the latest evidence. So on a regular basis, there's journals. I don't know whether you're using journals yourself now, but there's thousands of journals in every sector and subsector right there, and research being done all the time. And it's sometimes really interesting, especially if it's something you're curious about and you see a paper written on it. It's good to have a read. And sometimes you can even adapt the way you operate within yourself or within your department in line with this. So that's quite a good feeling, because you feel you're staying on top of things, you're at the cutting edge of it. Further study. I mean, this doesn't have to be formal qualifications. A lot of dietitians do go on to do master degrees as well. And they'll do them alongside their jobs. So that might take them 2 or 3 years to complete the masters. That'll be a period of study leave, or 2 days a week at university for a period of months, etc. So there's the opportunity for that, or it could be you're doing some as a lesser kind of qualification, and your manager will always encourage you to do those things, because it's good kudos for the department to see that they've got these well trained and skillful dietitians there. Conducting research within your role as well. So this really helps to improve the quality of the things that we do. So for instance, at the moment, I'm doing an audit. So that's where we will gather data on a particular part of the care that we provide. to make sure that it is achieving what we hope it's achieving. Sometimes it's not, and that's evidence to show that we need to make some changes to make sure that our the service we provide is the best that it can be. So there's always some research going on within the department. My colleagues are often asking, if you see a patient with a certain condition, can you let me know? I'm gathering information about it. So it's always ongoing. And sometimes off the back of that, what you've researched and produced maybe a small report to provide evidence of this, it can lead to getting papers published. I'm sure it's no surprise there's lots of conferences out there that we all go to, and we're always trying to promote the good things that we do within Salford or any trust that you work for by producing a published paper, and it gets your name out there in the wider world of medicine, and sometimes it can lead to bigger and better things. Teaching is a fundamental part of what dietitians do. Obviously, while students are going through their degree, they have to have some clinical time. And so we have students for a lot of months of the year. We have small gaps between the students, but we have them a lot. And as a qualified dietitian working in a department, it's you have a role to play in supervising those students, mentoring them. They'll come on the ward with you, they'll see what you do, you'll sit and do tutorials with them. So it's a big part of helping to future-proof dietitians to come. So this next generation and the next generation of dietitians, you're helping to train them for the future. And then training, which is, I've separated it out from teaching because it's something that's a little bit organic. You're picking up on maybe issues on the ward where nurses or other staff on the ward are not maybe doing things the way that it would be best to be done. Obviously, communication between nurses is really important for us. They're the ones that see the patient for the whole of a shift. So when we come to see them twice a week or however often we are reviewing the patient, we need information from them. Often it's writing down what the patient has eaten or drank, symptoms, things like that. And so we're often trying to identify gaps in their knowledge. And then we'll do some, kind of ad hoc or some kind of planned training to roll out over a period of days or weeks on a ward to make sure that everyone's singing to the same hymn sheet. There's obviously a turnover of nurses on the ward, so they don't always get passed on this information that we require. So that's where we come in and we'll retrain the new nurses who have come along. And all of this leads to, career progression throughout the NHS and even moving sideways into other areas as you get a more experienced dietitian. So these are things that we do every day or every week of the year, really. Okay. So when I look back over my almost 9 years now, about what I have learned as a dietitian that maybe I didn't appreciate whenever I first went into the role, but I really do know an awful lot about food now. Some of it's a little bit boring and a little bit kind of sciencey, but you do get to know food really well. We have to give a lot of practical advice to our patients. And when I'm in the supermarket shopping, I look at food in a different way now. I'm often inspecting labels so I can advise on different brands and things like that whenever I have a patient in front of me. I also know an awful lot about myths surrounding food and its relationship to being healthy, and I put healthy in inverted commas. There's a real tussle about what healthy actually means. Is it, the weight that you are? Is it what you eat? Is it how much you exercise? And so they've all been, at parties and social gatherings, I'll often get asked about diets and fads and things like that. And so you can't help but just absorb that kind of information as you read it online or in the newspapers, etc. And then, working in a hospital, it's a very clinical role, and you get to understand an awful lot of things to do with, biochemistry. So that's kind of looking at a patient's bloods or results of tests that they've had on themselves and interpreting those, because they're important that you understand those so you can put a plan in place that's realistic and is going to achieve whatever your goal is. Anatomy, that's, you know, you learn the book stuff whenever you're at university, but when you actually get into the job and you're on the wards yourself, talking to doctors, looking at scans, etc., it really comes alive then. And kind of those chemical pathways through the body, enzymes, hormones, etc., you get to learn an awful lot about those, and it just becomes quite second nature after a while, which is reassuring. It's a very collaborative job. You're not an island, you're not alone. You've got lots of colleagues if you need them. There's always someone you can pick their brains on a certain situation. We talk a lot about patients that we're seeing and what would be the best thing to do. There's never just one answer. There's often multiple answers, factoring in all the variables. And you need lots of allies to join forces with, and they're basically everybody you can come across. It's good to you get to know some of the nurses really well, and sometimes you think, oh, I'm glad they're on duty today. Certain doctors, you know, other health professionals, even the helpers on the ward, etc. So it's good to reach out and have those open communication lines with them. And communication, it's super important. You get better at it for sure as you get into the job, taking opportunities to, you know, make a phone call or speak to someone when you're on the ward, etc. So it's really important. Of course, communication with the patient, they're at the heart of all of that. They need to know what your plans are and what's going on with them. And I've come to know very quickly that people are really interesting. Sometimes they're very predictable, very unpredictable, but there's never a dull moment. And the future's exciting. There's lots of opportunities to change direction, learn some new things, learn deeper things. You really have an expertise that people will come to you for, because they know that you've got extra knowledge, etc. So there's lots of opportunities to keep learning and moving forward. Okay, so I think this is just one last slide. Just tells you, I don't know whether you're aware or interested in how you actually become a dietitian. So it's a 3 or 4 year degree course, so it's an undergrad course. Or if you already have a relevant science degree, and there's a lot of them that are relevant, so nutrition, biochemistry, sports science, things like that. You can convert your degree by doing a diploma or a master's. You can do either or, it depends. And that'll take you about 18 months to 24 months perhaps to finish that. And that's when you can become a dietitian. At the moment, there are 8 universities around the UK that offer the undergrad course. But excitingly for you guys, because you're Northwest, is that Manchester Met University and UCLan up there in Preston, they're starting the degree themselves in 2022. Entry level is A level, so you do need biology, that's the must-have, and then it could be any other science, so chemistry or physics, even geography. There's a few others you can do as well, like environmental sciences, etc. Or access to science, which is the route that I took, or there are other foundation courses in science that will also be relevant. And there are 13 universities currently that offer the master's degree, so they're much more spread around the UK. The 8 that offer the degree at the moment are very strategically placed around the UK, so that they're not all in one, or not all in the south, not all in the north. They're kind of spread around if you don't want to travel too far from home, or you do want to travel too far from home. So there are 13 universities. There's a few more that offer the master's degree. Some resources, just the British Dietetic Association is the professional body that we are part of whenever you qualify as a dietitian. Very, very useful association to be part of, always producing lots of good information and advice for dietitians, and a little bit more information on the NHS Careers website as well, if you wanted to have a little bit of a look on there. And that's kind of it, really. So I'll stop sharing now.
Thank you, Lucia. That was really interesting. Thank you so much. I'll just keep the chat box open for anybody that would like to ask Lucia any questions, or if you'd like to switch your camera on and raise your hand, you can actually speak to Lucia on camera. So it's entirely up to you. So we'll just leave the chat box open and see if anybody wants to ask a question.
So I should have asked at the beginning, really, kind of what stage are the students at? Are they A-levels, or are they 18 plus, below 18?
So these are mostly 16 to 18 students, and mostly T-level students, which is equivalent to 3 A-levels. That's the new qualification that we've brought in. But there's also possibly some level 2 and level 3 students participating as well. Health and social care students might be on this talk. So it depends. I think in our college we send this out to everybody within the faculty. So you've got quite a mixture, and there's probably some adult students that are potentially on the call as well, because we do get some adult students as well that are over 18.
Yeah, like I was when I decided to go back as a mature student.
It sounds like such an interesting career, and even, you know, though you say you went back quite late, you've done such a lot in what seems like a really short time, and it's just so much more that you can do. So it's really interesting to hear, and I think for our students that, you know, these are the kind of talks that we want to be bringing so that they can have a really good idea about all the other possibilities within the healthcare service that maybe they hadn't have thought about at all.
Yeah, that's it. I mean, the NHS is a wonderful institution to work for. There's it's varied every day. I don't have any day that is like the previous one. It doesn't mean that it's chaotic and stressful. I think every job that you care about brings an element of stress because you want to do the best job that you can. But you're never alone. There's always lots of people there, lots of other dietitians and managers that you can just, you know, run things past if you're not sure what plan you want to put in place or how to interpret results, etc. So that's a really important part of it for me, is having people around me that I can, you know, kind of bounce ideas off, etc. At the moment, it's a very female-dominated role. We do have 3 male dietitians in our team at the moment. Actually, probably 4, sorry, I should say. There's more and more guys coming into the profession, which is really good to see, because sometimes I think it's good to have an equal representation, because we see as many female patients as male patients, and sometimes people respond better to one or the other kind of thing. So, but there are a lot of females in the job at the moment. So is anyone curious about being a dietitian in the audience at the moment? Given any thought? It wasn't something I thought about when I was that age. But the NHS has quite a high percentage of nurses, health professionals who go back to university when they're a little bit older. Maybe not as old as I was. I was 40, like I said, but, you know, in their mid-20s, because they weren't really quite sure what they wanted to do, go off and try some other things, or maybe work for a few years and then decide, yeah, actually that is something I would like to do. I'd like to work for the NHS in some capacity or other.
So the chat box is still clear at the moment, just to let you know, Lucia.
Yeah, okay, that's fine. So, Joe, how often are you running these sessions?
They're going to be every 6 weeks, and we're alternating between the 4 colleges who's hosting them. So Oldham College have got the first 6 weeks, and then we pass on to the next college. I'm not sure who's after us, to be honest, but it's going to be ongoing. I think definitely throughout the first year anyway. And as I said, it's, you know, we've got a host of professionals from all different areas of the NHS, the NCA, to come along and support the students.
Right.
So it's very fresh and very new.
Really good,
yeah, and this is only our second one.
Okay.
Yeah, so we had one last week. This is our second one.
That's a really good idea. I think I would have loved this at that age, actually.
Yeah.
Even just to kind of confirm that isn't what you thought it was, or you know, just sow a little seed for the future. So
I think by the time the students have had all of them from all, you know, the various colleges, that they'll have so much information and just be armed with, you know, this kind of library of the different jobs that are available.
yeah,
And be really informed, so they can make those choices as they're going on through their studies.
yeah,
You know, so that they can just, you know, make the right choices for them, really.
that's it. And often we have inquiries from people who maybe are just about to finish their A levels, or a bit younger, or at this age, kind of 16 to 18, who are curious about it, but they don't know yet. So they will come and spend a few hours on the ward with dietitians,
Yeah,
just to get a flavour of how it is, and often that confirms it one way or the other. Sometimes people just think this is not for me, and other times people get a little spark and think, yeah, I'm gonna apply for dietetics now.
that's great. We just had Berry and Hopwood have said thank you, and there's no questions, but they've really enjoyed
No
the
problem.
talk. So I think we've only got the 2 we've only got the 2 colleges here at the moment. So I think that's everything from everybody, really, Lucia. So it's been absolutely fabulous having you this
No problem.
afternoon. Thank you for giving up your time, because we know you're really busy.
You're very welcome. It was nice to do it. Thanks for the chance to do that.
Would you be able to send the slides over, the PowerPoint over to us, please, Lucia? So I can send that out to everybody. That'd be
I
great.
shall email that over to you, yeah?
Yeah, if you send it to me, and I can disseminate it to everybody.
That's no problem. Thanks a lot. Good luck, everybody.
Thank you so much, Lucia.
Thanks, Joe. No problem.
Take care, everybody. We'll see you next week.
Bye-bye.
Bye.